Hi everybody, this is Dr. A with the second video in our venipuncture complications. We're going to talk about all the things that can happen during collection to complicate venipuncture. Okay, so the first one is fainting. So sometimes patients may faint on you. They usually can feel it coming and they usually tell you they don't feel good a few seconds usually before they go out. So also before syncope and often after, the patient's skin is going to feel cold, damp, and clammy. They'll have beads of sweat that can come on the forehead or upper lip. And they may state again that they're not feeling well, or they'll stop talking, get really quiet. Their eyes could roll back and their head will tilt either forward or backward or even sideways, depending on how they're sitting. So fainting is more common with outpatients. Inpatients and still lying in bed are less likely to faint. So this is why you usually want to use a chair that has, side arms and arm thing that comes down, so they're kind of encased in the chair so that they don't slide off the chair. If they're sitting on a tall chair or stool or something, they could fall off. So that's very important to stop whatever you're doing and to, if they're falling or whatever, and to catch them. So worse than that then is seizures. So sometimes patients could have not only fainting, but just full-on seizures. So if a patient has a seizure during the procedure, remove the tourniquet, remove the needle immediately, apply pressure to the site. Don't put anything in the patient's mouth, just let them go through the seizure. And just stay with them while they're having a seizure until they start coming back to, and then take care of them. You may have to take them to the ER or call nurse, doctor, or whatever if they're an inpatient. So nausea and vomiting, so that's emesis. So if emesis occurs, reassure the patient, make him or her comfortable. It's handy to have a trash can nearby or an emesis basin or something that they can throw up in. But usually trash cans are more handy than anything. So if they feel it coming, if they're going to be sick, you better take them seriously, because that usually means that within the next few seconds something may be coming back up. So pain to prevent the startle reflex, so them jumping, do warn them before the needle sticks so that they're not startled. So just tell them there's going to be a little poke or pinch or sting, whatever you want to use, just something to warn them that they may be uncomfortable and pinch or sting for just a second. So when blood oozes from the vein into the surrounding tissue, you will see a hematoma or a bruise. You can see that the skin surrounding the puncture is going to be swelling up and filling with blood. If this occurs during the procedure, you need to remove the tourniquet and the needle immediately and apply pressure to the site. The longer you stay in, the worse the hematoma or the bruise is going to be. A cool cloth or a cold pack can slow the swelling from the blood and ease the pain. So sometimes there's lack of blood flow when you try to draw some blood. This can be caused by a defective tube if you are using the multivac evacuator system or a butterfly. It could be an improperly positioned needle, so the needle could be against a wall, against a valve. They could be too flat, or they've missed a vein, of course. If you see intermittent or slow blood flow, that usually indicates improper needle position or a collapsed vein, or maybe the needle's not all the way in and the bevel is only partially in, or the vacuum has been too strong for that fragile vein and it collapses the vein from the strong vacuum. So always have extra tubes to the bedside or have them within comfortable reach or in the outpatient area to be prepared for defects or errors. I like putting some in my pocket on my lab coat. So sometimes there will be some defective evacuated tubes. So sometimes you're in the vein, the blood is just not flowing because the tube has lost its vacuum. And so this could be a manufacturing defect, a tube that's expired, or there's been a really fine crack in the tube, which could occur if the tube is dropped. It's easy for things to get dropped. So it's possible. Again, it's another good reason to have extras on hand. If the tube is not the problem, the needle then may not be properly positioned in the vein, and you may need to adjust it slightly. If the tube is too large for the vein, so that causes excessive vacuum to pull the vein onto the bevel and block the blood flow. So the vacuum is sucking the edge of the vein onto the bevel and sealing it shut. And so a collapsed vein is going to be caused by too much vacuum on a small vein. And so when you use it with the evacuated tube system, a collapsed vein becomes evident where the tube is pushed onto the inner needle. So when you put the tube on, you can see, especially a hand vein, you can see it go flat. You take the tube off, the vein pops back up. That would be issues with a collapsed vein and too strong of a vacuum on the tube. Sometimes veins can roll excessively, especially veins on the back of the hand or in elderly patients. So you always want to anchor the vein or pull down on it slightly with your free hand. An inadvertent puncture of the artery sometimes can happen, especially if you're sticking in the basilic area. And the way you would see that is the blood is going to be bright red and could be spurting or pulsing into the tube. If you hit it with a butterfly, you can see it pulsing inside the tubing before you put the tube on the other end to pull the blood in. So if you fail to collect blood on the first try, the policy at most institutions is that a second try is acceptable. You're going to use a new needle and new tubes, and for second tries, go below the previous site or use another arm or another site. So 2 tries is, most people let you try again. That's usually cool. If you miss it twice, you need to go get somebody else. Prolonged bleeding. So normally the site should stop bleeding within 5 minutes. In all cases, you must continue to apply pressure until the bleeding has stopped, even if it takes longer than 5 minutes. Hemolysis, so it's the destruction of blood cells. It results in the release of hemoglobin and the cellular contents of the red cells into the plasma. The serum or the plasma is going to be pinkish or red in a hemolyzed sample, and it is due to the rupture of the blood cells. And so I can have this as an example of a hemolyzed sample. So what causes hemolysis? So you'll see I've highlighted using syringes is already a big cause. So if you have blood frothing in your syringe and it's caused by a needle improperly attached to the syringe, so the needle is not tight enough and so air is sucking here into the hub because the syringe is not tight on the needle, or the needle is not tight on the syringe. So it pulls air bubble in, and that can cause hemolysis. Drawing blood too quickly into a syringe, so really pulling back and trying to get it to fill up really quickly instead of letting it fill up more naturally. Excessively shaking or rotating the blood, so you don't want to shake it, you want to gently invert it. Failing to allow the blood to run down the side of the tube when using a syringe to fill the tube. Forcing the blood from a syringe into a vacuum tube to make it go faster. That's not a good idea. Using too small of a needle with respect to the vein size and the amount you have to draw. For example, if you were drawing a 10 cc syringe, you probably do not want to use a 23 gauge needle. You would probably be much better off with a 21 gauge needle if you had to use a syringe. But if you're going to use that gauge, you probably should use an evacuated tube system. But sometimes you have to do that for blood cultures. You have to use a syringe, maybe. So, using a needle smaller than 23 gauge, you should not use a needle smaller than 23 gauge. So usually any smaller needle causes hemolysis. So there are some around because they can be used for injections, but they should not be used for blood draws. Using a small needle with a large vacuum tube, again, not a good idea. Using a small needle to transfer blood from a syringe to a tube. Mishandling and improper transport of the specimen can cause hemolysis, and readjustment of the needle in the vein can also cause hemolysis. What tests are affected by hemolysis? So the ones that are seriously affected are the AST, the potassium, and the LDH. The ones that are moderately affected are going to be the ALT, the CBC, the serum iron, and the thyroxine. And the ones that are slightly affected are the acid phosphate, the albumin, the calcium, the magnesium, phosphorus, and the total protein. So let's talk a little bit about long-term complications of venipuncture. So the first one is iatrogenic anemia. So this is anemia that is caused by medical procedures or by being in a hospital. So, and this will be excessive removal of blood at the request of a physician. So there's just so many tests that are being done all the time, and stuff is being repeated or drawn daily, and that can all add up. So removal of as little as 3 to 4 mils of blood per day may result in the development of iron deficiency anemia in some patients, especially if they're already coming in anemic or slightly anemic. You can make things worse. And, you know, one CBC tube, regular CBC tube, or one regular chemistry tube would easily hold 2 to 3 mils of blood. Next is compartment syndrome. So for patients that are receiving excessive doses of anticoagulants, such as warfarin, or who have a coagulation disorder, such as hemophilia, routine venipuncture can cause bleeding into the tissue surrounding the puncture site. So, and then that can cause swelling and compartment syndrome. So, severe pain, burning, and numbness can be followed by paralysis that's distal to the puncture site, so it's away from. So, if we did a puncture site of the antecubital area and compartment syndrome happens, it's going to happen in the arm, the distal part here, and into the hand of the puncture site. And so as the swelling is interfering with venous return, and if you have large amounts of blood that's leaking into the arm and lots of swelling, then that can cause compartment syndrome, which is a condition in which the pressure within the tissue prevents the blood from flowing freely in the blood vessels and the veins and returning. So the patient needs to seek immediate medical attention if they even suspect compartment syndrome, and this is one of those where they would have to slice the arm open to relieve the pressure to allow the blood flow, or the entire arm could be lost. Nerve damage. So the nerves in the antecubital area can be damaged if they are contacted with the needle during collection. The procedure should then be performed at another site, preferably in the other arm. So if you touch somebody's nerve, they will feel a shooting pain, and they will know right away. And to prevent nerve damage, you need to avoid excessive or blind probing during venipuncture, and you need to avoid using the basilic vein whenever possible. So that's the one that's more towards the inside, that's above the brachial artery. And then infection can be prevented by adhering to venipuncture protocol. Proper aseptic techniques before and during collection have to be followed. Do not touch the venipuncture site after it has been cleansed. And so if any of these things happen and go wrong, the patients could rightfully sue you. Compartment syndrome, nerve damage, infection, any of these things, or could at least sue the hospital or the clinic. Lastly, we're going to talk about specimen rejection. So clotted blood in an anticoagulated specimen can cause rejection. So if you drew a CBC tube, it should be all anticoagulated, and if it wasn't mixed properly and there's a big old clot in that CBC tube, then it will be rejected. Collection in the wrong tube. So sometimes that can happen, especially when nurses collect samples. They grab the wrong tube, or they're not sure. And they can't just swap the tops of the tube. So you need to pay attention with the label on the tube, etc., that it's the right anticoagulant in the right tube. Sometimes there are some contaminated specimens in containers. Usually they're contaminated with IV fluids. For blood, there can be a defective tube, hemolysis, improper special handling. So, for example, if the specimen needs to be protected from light and it's not protected from light, if it needs to be on ice and it's not delivered on ice, those are improper handling. If they're incompletely or inadequately filled tubes, this is quantity not sufficient, so it could be not enough to test, period, or it could be that the ratio of anticoagulant to blood is completely off and the results would not be accurate. If they're received with no requisition forms, or they're unlabeled or mislabeled, if expired vacuum tubes were used in a collection, if there's an incorrect time of collection or no time of collection, and if there's any delay in testing, meaning they were collected many hours ago and maybe misplaced, lost, forgotten on a tray or something, and then hours later they're trying to run them, well, some of the tests may not be valid anymore, so that would be the delay between the collection and the testing could cause the specimen to be rejected. So, All right, that's it. The next videos are going to talk about special populations, so I'll see you there.